Our lead story this afternoon, well, an 18-year-old boy died on the spot while attending a class. He suffered a sudden heart attack. The student collapsed on the desk in the classroom. There you can see an absolutely shocking visual there. A shocking death at the Indore coaching center. This, of course, has put the spotlight back on exam stress and coaching stress. Multiple such heart attacks in youngsters have been reported in the past couple of months. An 18-year-old boy dying on the spot because of a heart attack. Extremely shocking there, and a worrying trend that we've been seeing in the past couple of months, as I said. Joining us on the broadcast now, Dr. Rajeev Jayadevan, who's a Vice Chairperson of the Research Cell of the IMA in Kerala. Dr. Jayadevan, thanks very much for joining us on this extremely concerning trend. We've discussed this in the past as well, how youngsters and young hearts are vulnerable to heart attacks. What is the primary reason? Is it related very closely to their lifestyle? This seems to be a lifestyle disorder, certainly, given the fact that they're enduring this level of stress. In fact, in this case, a boy collapsed, on the desk while attending the class.
Yes, the video shows the person becoming uncomfortable, collapsing quickly onto the ground with very little notice. So clearly, the person was well enough to attend the session, and whatever happened came on really quickly. And these are typical instances of what is called cardiac arrest. Now, cardiac arrest is a situation where the heart stops, or it stops beating well, or it starts beating ineffectively, in the sense it's not able to pump blood anymore. And that is typically the presentation that we see here. Without further medical information, I'm unable to comment on this particular case. But if you look at the causes of cardiac arrest, it is quite different from heart attack. Heart attack is actually a blockage in the blood vessels that supply the heart. A cardiac arrest, on the other hand, it's like a power failure. Imagine a table fan, you pull the plug, the fan stops working. So cardiac arrest is something like that. It has many causes. In this particular age group, the person appears to be very young, perhaps 18 to 20 years old. In that age group, the commonest reasons will be a rhythm problem of the heart. These are inherited conditions commonly. There are a list of conditions. I do not wish to go through the entire list. Something called long QT syndrome, the Brugada syndrome, yes, and several others, which can result in a sudden event. The lesson that we should take away from this is whenever a person collapses suddenly, everyone, I repeat, everyone should know what exactly to do. What needs to be done is immediate CPR.
Dr. Jayadevan, because 40% of these cases are actually reported at home. These cardiac arrest cases or these heart attacks are reported at home. What do we really do? Because we do not have a CPR training. I mean, that is extremely critical. Most, lay people might not be aware of how to react in such a situation. What should we do? What should be our first response in such a situation?
Yes, it's an excellent question. A good response will be to do immediate CPR. I'll explain what is CPR to our viewers. CPR is a process where a person who is assisting the victim is able to place compressions on the person's chest while lying down in an attempt to keep the blood physically pumped into the blood vessels. In other words, you pump the heart from outside using our own hands to squeeze the heart to push blood into the vital areas of the body, such as the brain. Now, CPR, we've all seen videos of CPR. That needs to be done until help arrives. Now, help might take a few minutes to come, say an ambulance coming in, trained personnel coming in. Until then, this process has to continue relentlessly. And in large public places like what we saw in the video, it's important to have what is called a portable defibrillator, which basically is it's the size of an old VCR. You plug it in, and the machine will diagnose the heart rhythm immediately and also help us deliver shocks and cure the patient. So in most public places now, airports, railway stations, large public areas, yes, there are defibrillators coming in. These are not very expensive, and also to operate them, people should know how to operate them. It comes with instructions which appear on screen. But more importantly, everyone around should know immediately what to do when a person collapses. Yes. I'll explain what should be done.
Yes,
if a person collapses and is not breathing, don't stand around and ask questions. Just start CPR.
Okay.
I repeat, if the person falls and is not breathing, go ahead, start your CPR, ask questions later.
Okay. And my last question to you, Dr. Jayadevan, very quickly, how is this linked directly to stress? And in this case, or in cases like these, exam-induced stress or, coaching-induced stress, what do we do in such cases? Because, the kind of stress that youngsters are, almost coerced to endure these days, whether it is work-related stress or, classroom-related stress, how significant is that, the stress factor in this entire scenario?
Well, it's very hard to say that stress caused the event we saw on the video. It so happened that when the person was sitting in class when the event occurred in his heart, it's very difficult to say that the stress actually caused it. But overall, I'll say this to younger people, do regular exercises. If you have a family history of anything unexplained, go get a checkup. And also never smoke, never take alcohol if you can avoid it. And also sleep well. People who, I understand these people were preparing for exams. No matter how hard you're preparing for your exams, make sure you get enough sleep. Now, I'm not saying that these are the causes for the individual's collapse, but in general, these are good general health advice. Make sure your body is physically active. You sit for long hours, make sure you do your exercise, you sleep well. And
so having a regulated lifestyle, I think, is critical, in these cases. Extremely worrying there. Dr. Jayadevan, thanks very much for joining us on a very important subject, young hearts at risk. Multiple cases being reported now of youngsters being vulnerable to cardiac arrests and heart attacks.